Very interesting details coming out in the study, but I have to start by asking you this, the first question that really comes to mind here is that not everybody will have the same amount of antibody cover post their infection, right? We've seen some people develop very good antibodies, some none at all. So how do you factor that when you say and conclude in a study that only one dose to those infected and thus significantly with antibodies is good to go for now?
Thank you, Sonal, for having me on the show. When we actually conceived this study, we thought it was important to utilize our vaccine resources very intelligently. And so therefore, what we did was we took patients in actually hospital employees who had COVID about 3 to 6 months before and compared with them those who didn't have. You raised a very important question regarding the antibodies. You're absolutely right. It's very difficult to correlate the antibody levels with protectiveness and so on. There's a lot of debate in the literature on that. But what we did was when we actually looked at the antibody levels in those who had COVID long back, say 3 to 6 months back, the antibody levels were very low actually, not very high. And we specifically looked at neutralizing antibodies against S1, S2 spike proteins. But when we then gave them a shot of single dose of vaccine, the antibody levels went up to 1,000 units, which was 10 times more than what would happen in a normal person who didn't have a COVID. So we actually had a comparative group of those who didn't have COVID, and their antibody levels went up to 100, whereas those who had COVID earlier, their antibody level went up to 1,000. But as you rightly said, does this mean that antibodies will definitely protect against this infection? So we went further actually. What we did was we looked at the T cell memory cells. Now we know that antibodies at a certain level can be helpful, protective, but we're not always sure. What is more important is the so-called T effector cells. Our body has these memory cells which actually memorizes any virus or any foreign body that comes into our body. These memory cells go back into the bone marrow and wait there, and whenever there's a new infection, they immediately come out and then they actually make the B cells produce large amount of antibodies. So this is a more effective mechanism of protection and long last. So we looked at two types of T cells, T effector cells, CD4 and CD8. And what we found was both these CD4 and CD8 were markedly increased in those who already had an infection and took one dose of vaccine. Now this means that CD4 is medium term and CD8 is long term protection. This means that those who take a single dose seem to be protected for at least 12 months against this infection because of such high levels of memory cells. So
12
memory
months, you say?
More important.
Okay.
Yeah.
Okay. Can I also then ask you which vaccine have you tried this on? I'm assuming this is all on your staff, so it has to be an India vaccine?
Yeah, so what we used in our staff was predominantly Covishield because that was a vaccine that was given to healthcare workers in the first injections that were done.
Right.
This was in January to February the study was done. But I believe that this could be reproduced with all the vaccines. In fact, we are now going forward with a study where we are trying all the three vaccines, Covishield, Covaxin and Sputnik in the same way to see if one dose is sufficient, because then you save at least one dose, and this also actually
for
goes
the rest
into
of the
government
population.
policy.
I understand that. Also, I just, the issue of antibodies is very interesting.